proudly acknowledge the Bunurong people of the Kulin Nation as the traditional owners and custodians of this land that we're on today, and pay our respects to their elders past, present and emerging, as well as any Aboriginal or Torres Strait Islander community members with us today. So why are we here? As you would all know, there has been a change to the providers of Regional Assessment Services, or RAS, from July 2024 through to December 2024 in Victoria. And as we all acknowledge, this is a significant time of change for both RAS and CHSP providers. So we're really excited to have you all here today for an information session for Victorian CHSP providers to meet 4 of the RAS providers. Now, they are all experienced assessment providers since 2015 and are embedded in areas where they assess, so they all have a local presence. There are other small assessment providers who are existing RAS providers here with us today, but not part of the panel discussion. So joining us today is Rochelle Collard, who is the Manager, Aged Care Assessment and Transition Care Program with the Victorian Department of Health. Rebecca Woods, who is the Executive Director, Aged Care Access from Aged Care Network Australia, or ACNA. Fiona Lynch, General Manager of Assessment Services, and Jessica Floyd, National Operations Manager for APM, and APM has also been known as Serendipity. Michelle Marchant, Senior Project Officer from Aspire for Life, and George Pappas, Regional Director in the Victorian Local Network and the statewide lead of in-home aged care for the Department of Health and Aged Care. So thank you everyone for your questions, and there were many, and we are hoping that we will be able to cover most of them in the panel discussion today. You will also see you can add questions via the Q&A function. We are on a time limit, so we might not get to all of your questions. So any unanswered questions, we hope to get a written response out to you. Given that this is an introduction to RAS webinar, we will only be focusing on RAS questions, but however, we are looking at some opportunities to have further discussions about specific service delivery questions, my aged care and assessment considerations. So first of all, I am going to hand you over to George Pappas from the Department of Health and Aged Care, and George is going to set the Victorian assessment context before the panel discussion. So welcome, George.
And thank you, Alison, and good morning, everyone. I hope you're all well. Firstly, can everyone hear me? Yep, we can. Good. Look, I might begin with acknowledging the work of the Victorian Sector Support and Development Network in hosting this event in the first instance. And as many of you will know, we have been strong supporters of the roles of our SSD funded roles under CHSP now for many, many years. They are great, a terrific resource, and one that will be pivotal also going forward with our wider reforms that are still coming. Now, today I will give a bit of a short contextual overview of the work that has been undertaken, that was required to be undertaken to transition assessment arrangements in Victoria, and why. In essence, agreement was reached between the Commonwealth and our state counterparts for the Commonwealth to progress RAS assessments effectively from or RAS arrangements rather, effectively from the 1st of July this year. And that is 6 months ahead of the single assessment system commencing in January. This decision was taken in April this year, and given the Commonwealth did not have individual contract arrangements with existing RAS entities for the purpose of assessment, this meant that we were required to undertake a limited tender, open to existing assessment agencies, to be conducted in a very short time to enable us to have assessment services in place across all regions by the 30th of June this year. Time was most definitely not our colleague and our collective friend in this process, as the department were required to develop a tender plan, including tender documentation, establish an independent national tender team, conduct the tender and associated assessments, negotiations and contracting of successful applicants, and all to be completed in around 3 months. And this included the transition of between 11 and 12,000 clients awaiting assessment, along with their associated records, and connecting where possible our skilled our skilled assessment workforce with the newly commencing RAS providers. This process was also taking place at the same time that training was being undertaken by the assessment workforce to support the rollout of our integrated assessment tool from the 1st of July this year as well. So overall, there was a lot to do in a very short time frame. And this, to support us, I should say, and to ensure as far as possible, we were considering all the possible ramifications for such a large transition. A transition advisory group was established involving 3 levels of government and our RAS providers in the main. And now this group has until recently served us very well. It came together very quickly and supported us with expert knowledge and genuine good intent, with each of these stages required in the preparation for and the implementation of the transition. And we wish to acknowledge their collectively their considerable contributions. The outcome of the limited tender in Victoria resulted in a significant change for us all, as we transitioned from around 75 organisations to 12 organisations. We also transitioned away from local government level assessment boundaries to aged care planning regions. And this was another significant change for us in Victoria and something we will be working through. The department also concluded negotiations with the former First Nations RAS assessment agencies regarding the ongoing provision of assessment services to First Nations people in key catchments. And catchments not covered through these arrangements will be covered by other recently appointed RAS providers. So overall, in context, there has been a lot of change for us all to absorb. And at this juncture, we would just like to acknowledge the efforts of all of our former RAS entities over many, many years in support of your communities. Now, separately, it is important to note that the limited Victorian tender was different to the tender run for the National Single Assessment System, which is currently still under assessment for services commencing from the 1st of July next year. We are expecting to conclude assessments between September and October this year, after which negotiated arrangements for services will commence for our future single assessment system. But more locally, it has been now 5 weeks since the transition in Victoria, and whilst we've had challenges in pockets, our new team of assessment agencies have pulled together to work through their ramp-up phase whilst supporting the important assessment needs of our older people, including the prioritisation of high needs clients, which has been their key focus. And so today we will have an exciting opportunity to get to know our new RAS organisations. Our newly appointed RAS entities have hit the ground running, and together with your help and collaboration, we'll be working to meet the needs of our constituents going forward. And indeed, they already are. Some of these entities you will know and be acquainted with, and some are actually veterans in the field, as we've heard, since 2015. And in addition, they have already recently agreed to be part of a statewide network of assessment providers to work collaboratively with us, which we support and implore. And so on this note, I would like to very much encourage you all to work with our new assessment agencies to assist with any local context that may be relevant and about how we can add value to our local systems across the state. And I think I might leave it there, Alison.
George, thanks for setting the scene. I would now like to introduce Melanie Perks from the Grampians and Lisa Dean from Eastern Metro, who will facilitate the panel discussion. Thank you.
Thanks, Alison. It's wonderful to have all of the assessment organisations that we have here today. We just thought we'd like to kick the conversation off if we could, you could tell us a little bit about each of your organisations, and we might kick that off with Michelle, if that's okay.
So a little bit about Aspire for Life. And I could probably talk forever, but I won't. So Aspire for Life started in 2015 with the rollout of the our RAS service. We our RAS, we started with across 15 aged care planning regions in New South Wales and Queensland, and we were able to transition in 2 more regions in 2018, and then lucky enough to, as you know, we're here across 8 aged care planning regions in Victoria. So we also have a a veterans home care assessment service that works across across parts of New South Wales, South Australia, and the Northern Territory. We've got a bit of a different system. So we've got a national office that houses our rostering and our logistics and our admin components and our colleagues. But we actually, all of our assessment workforce is embedded out in our aged care planning regions. So they're embedded in our community. Our assessors, our leaders all live within their communities across all of those aged care planning regions. So yeah, we're quite proud of that. I've got a couple of notes. So we provide face-to-face services, assessment services, as does everybody else. We align our services, our service delivery with our assessment service delivery with the guidelines in our contractual agreement. But definitely there's a component of client choice there. We will consider like the urgency of the need for the assessment and any other extenuating circumstances that might relate to maybe needing like a telehealth assessment, but definitely working with the clients and service providers and care finders and other advocacy services to make sure that clients just get to assessments as quickly as possible.
Thank you, Michelle. That's great. We might hear from Fiona now, if we could.
Lovely. Thank you very much. It's fantastic to have the opportunity today, so greatly appreciate the work that's gone into making this happen. From the APM perspective, we're a company that's existed for 30 years. So we started life actually in the assessment space, and it was assessments that were being done to support injured workers get back into the workforce. That theme of providing high quality and timely assessments from that inception, it's really been in our DNA for 30 years. The company has grown astronomically in that time, and we now have a footprint in 11 countries. We support 2.1 million people a year, and we work right across the lifespan. So that can be from in our early start program, that might be support for a young child who needs speech therapy, right through to this program at the other end of the age spectrum. And as much as they're, I guess they're big numbers in terms of that footprint in 11 countries, etc., the statistic I think that will probably resonate with this group is for RAS clients, we consistently get feedback like a 4.8 out of 5 rating in terms of how well people experience the service. So we're really keen to move the learnings that we've had in the rest of the country, because we're in 24 aged care planning regions across the rest of the country. We're in 8 of the 9 regions in Victoria. So we're super excited to bring the learnings that we've had from doing RAS since 2015 across into this space.
Thanks, Fiona, a wealth of knowledge. Rebecca, would you be able to give us an overview of ACNA?
Yes, I would love to. Reiterating the thanks for the opportunity that all of the colleagues here today have said. ACNA is, look, it's a really exciting organisation. We started in assessment as well, so our roots are in assessment from 2011, and I know my wonderful CEO, Dr. Ricky Smith, is on the line, so you might have met her because she worked really hard in Western Australia around the establishment of RAS as an independent assessment agency for aged care. So our roots are really in that aged care space and the independent space. Myself, I'm really excited to be back in Melbourne because I was actually brought up in Woodend and I've lived most of my life in Victoria. So I'm super excited to get this opportunity to come from Canberra and be back amongst all my Victorian friends, family and colleagues, and really excited that we've established a team of wonderful Victorian assessors across the 2 aged care planning regions we're in, both Eastern and Southern, and we're spread all around those communities. So we're in the throes. I've actually got 10 people here today that are learning the ACNA active assessment method as we speak. We're really committed to those face-to-face assessments, holistic assessment, and understanding that client's ageing journey and how to really support them on that journey, including a really big focus on reablement. So that's our little snippet about ACNA, and looking forward to answering the questions.
Thanks, Rebecca. And Rochelle, would you like to give us an overview from your perspective?
Sure, thanks for that, Mel. I'm really pleased to be here, noting the significant change that the Victorian assessment landscape's gone through over the last little while, and to be here with the other main assessment agencies. So as a lot of you would probably be aware, the Victorian Department of Health has been responsible for the delivery of all aged care assessment in Victoria up until the 1st of July. So this is a significant change, not just for CHSP and the sector, but for all of us as well, and obviously for the assessors too. So with that, I also would just like to, as George did, really acknowledge the incredible work that our previous RAS providers did in this space for a very long time, and the way they represented and supported their communities and clients. And I think that's really gotten to us a point where we've been able to transition into this really strong space. So the department continues to be a provider of assessment. So we're responsible currently for all the delivery of all ACAS in Victoria, and also a proportion of RAS. So the RAS that we deliver is also delivered through our ACAS. There are 9 ACAS providers that are continuing to provide RAS services in your areas. So if you had a previous ACAS that was delivering RAS in your area, you still do. The exception for that is Lindock Living, and Barwon Health has taken over the RAS that previously belonged to Lindock Living, and Gateway Health has also exited as a provider of RAS for us, but continues to provide ACAS services. So look, we're really looking forward to the new model and working together. We acknowledge that there's going to be some changes for everybody, but I think this is a really good start to how we can work together to continue to deliver for, older people within the Victorian community.
That's wonderful. Thank you so much, Rochelle. Michelle, you touched on the idea in your opening presentation around being embedded in the field and conducting face-to-face assessments with the option, obviously, of client choice for telehealth. And I think, Rebecca, you also mentioned that you have staff in the eastern and southern metro regions. Fiona, I'm just interested to understand what APM's model of your model looks like as well.
Yeah, it's absolutely about embedding people in the local community. So to undertake the work in Victoria, we'll be recruiting, we're well advanced in that, 60 fantastic RAS assessors to work across Victoria. Just as they do, we've got 95 assessors working in the rest of the country. So they are people who are attracted to our notion of enabling better lives. They want to work with older people. They want to support people to be independent. It's important that they are embedded in those communities, that they understand the local connections and arrangements. So absolutely, yeah. And there'll be local team leaders. There's a dedicated regional manager for Victoria. So we're very much about that support needs to be location specific, yeah.
Yeah, that's wonderful. Thanks, Fiona. And Rochelle, we know that ACAS operate on the ground in Victoria and have done for many years. So I'm assuming your response to this is that there's not going to be too much changing in that space. Would that be correct?
Yeah, that's correct, Lisa. So we continue to have local services providing through our ACASs, and also our ACASs obviously then exploring with the changes into aged care planning regions rather than local government areas to how they maintain that, and then looking towards the future. And I did just want to clarify, I said that Gateway Health had exited as a RAS provider from us, and apologies, it's Goulburn Valley Health that has exited as a RAS provider but remains an ACAS provider, and Gateway Health provides both RAS and ACAS.
That's great. Thanks for that clarification, Rochelle. And I think it's comforting for service providers to know that, that face-to-face active assessment approach continues in Victoria. So thank you.
One of the other questions that's come through from CHSP providers is the management of referrals to providers. So we're just wondering whether you broadcast referrals for CHSP services, or whether you provide referral codes to clients, or are you referring directly to CHSP providers? Jess or Fiona, maybe I could get one of you guys to commence answering that one.
Absolutely. Thanks, Melanie. For us, all three methods are used, and it really does come down to clients' preference, their needs, support networks. We very much empower the client's independence. So it's ensuring they have the details to follow up. If they are given a referral code, they know who and where to contact and be able to follow up the method on that as well, or the follow-up method on that as well. It's something that we do with reablement. It could be direct referral, more so because we have that short-term or shorter-term support period. We're working with a client, as well as clients that may be going in linking support, which is quite direct because we're providing that additional layer there.
Great, thanks, Jess. Michelle or Rebecca, would you have anything to add to that?
Just to reiterate, the same with us. So we use all of those methods depending on the client that's in front of us and the way that we can best connect them through to service, especially those short-term services. So that was great that Jess emphasised that reablement's really, really important. And so those short-term services, we work very closely to put those in place in a timely manner. So yeah, all methods.
Fabulous. Thanks, Rebecca.
So we know, obviously, we live in a very diverse community and we have lots of different people with very different and individual needs coming through for assessment. So I suppose I'm just interested in understanding how assessment officers are working with these diverse groups. And I know George mentioned the elder assessment program that's in the process of being stood up as well. But yeah, what is your current approach to supporting, for example, people from culturally and linguistically diverse communities, or someone who may be at risk at homelessness? And perhaps I might direct that to you initially, Fiona, if that's okay.
Certainly, Lisa. It's a requirement that all staff undertake diversity training, cultural sensitivity training, training that's specific to working with First Nations groups. I'm really, really pleased to say that we've actually partnered with a First Nations recruitment provider for this work in Victoria, and we actually have our First Nations RAS assessor who will be supported with a mentorship program. We'll be starting to do that work, so we're already in that space. So we've got ensuring that we have something culturally appropriate ways of working. We do a lot of lunch and learns, so we'll do brainstormings and case studies and things to not just do like training at a point in time. We kind of feel this is something that we run and then we need to constantly kind of refresh and make sure people have got an understanding and a working knowledge, and that they understand difference but then don't fall into, say, stereotyping people by virtue of their background as well. So it needs to be quite a nuanced understanding of what cultural appropriateness means. So they have dedicated training. We also have in our scheduling system, and scheduling, most of our schedulers are based in Melbourne, they have a profile for each assessor. So if we have RAS assessors who speak other languages, we absolutely capture that. So that optimises our capacity to match with a client and have the best kind of possible interaction there.
That's wonderful. And I can see Rebecca and Jess nodding away and Rochelle nodding away. Michelle, was there anything that you might have wanted to add to that approach from Aspire for Life's perspective?
Absolutely, and just apologies for my internet connection. We're all getting used to that as well. So definitely for Aspire, we do a lot of research when we're going to support a new community or a new aged care planning region, having a look at the demographics of that region, and then focus our recruitment and onboarding around that. For us, for the initial component of this. Of us moving into Victoria, we are working with current or the assessors that were actually affected in the transition. So we're working with those people that we're already working within the community. But additionally, we work with specialist subcontractors as well, because like all the other organisations, we can't that cover all cultural and linguistic needs, and so we do have some specialist organisations that we work with. So we would be looking at, and we already have commenced those negotiations in Victoria as well. So we work with interpreters as they're needed, but definitely knowing what demographics are in our regions is part of the tender, but also part of our implementation plan.
That's wonderful. Thanks, Michelle.
We also wanted to get a bit more information around support plan reviews from you all. Now, we were aware that there's probably two parts to this situation, in that there's some outstanding support plan reviews, or ones that people have been waiting on prior to July, but also moving forward with support plan reviews. Rochelle, would you be able to give us some information about how support plan reviews are being managed?
Yeah, look, I think, Mel, the main thing is that obviously support plan reviews remain a really important part of ensuring that people can access the needs, the services, and to meet their needs, and that hasn't changed. For us, that process hasn't changed. Obviously, with the transition, there has been the transfer of clients and support plan reviews attached to those clients to the new providers as well. And I think, we know that when there's a change, sometimes, as George talked about too, there's kind of the ramping down and the ramping up that happens as well. So we obviously expect that we will continue to maintain those support plan reviews as a priority. And I think the really important thing for clients, and also for CHSP providers and home care providers as well, is that when the needs of a client have changed, it's really important to, as our CHSP providers and sector always has, is to communicate really well with our assessment providers as well, and make sure that when there's a change in circumstances, that's communicated, so that the prioritisation both of the support plan reviews and whether that needs a potential reassessment can continue in a timely way to meet those needs for those clients.
Thanks, Rochelle.
Fiona, I think it was you that mentioned reablement earlier. So we're interested to know, does reablement continue to be a focus for regional assessment? And what does that actually look like?
Yeah.
Rebecca, Rebecca or Fiona? Fiona, happy for you to start off, yeah.
Yeah, sure. We're absolutely committed to reablement. We were, like our colleagues here, we were part of the original reablement trials. So we kind of had those initial learnings that have been built into our day-to-day practice. We think this is an absolutely critical part of enabling people to retain and maintain their independence. So it's we're completely hardwired about this. The contractual requirement, as people know, is 10%, but we actually set a minimum of 15% of people, and we exceed that in terms of reablement, and that's really reflecting the fact that we don't want to do the bare minimum. We want to look for as many opportunities as possible to support people's independence and keep them conditioned and well.
That's great. And Rebecca, did you have anything to add to that?
Oh, I have to. We love reablement. That's like part of our gig and how we started. We actually, fun fact, we used to do the reablement training for all of ACAS and RAS throughout Western Australia. And then we oversaw the national trial where we worked with our wonderful colleagues with Aspire and APM to build the capacity of assessors that understood that reablement is absolutely embedded in the method. It's not an additional piece at the end that you look for. So my colleague Andrew here has been 10 years in ACNA, 5 years during the reablement training. He did the national project and he's just the next door over doing even more training. So yeah, I couldn't not comment, sorry.
Get to it later, but I think with reablement, and we were talking about, obviously there's that it's time limited, short term, and so I think it also just ties into it. And I think one of the questions about how can we work together and how can CHSP support assessors and clients to access those services, and I think that's where I will just put in a little piece around the fact that the more up to date your your portal and the information that's available in MAC for your services. The more current, the more it reflects where you offer services, what services, availability, all of those kind of things. That really supports not just reablement, but referrals and access as well. So I think probably everybody here would agree that that's probably one of the number one take-home messages from today, if we can have one.
Thanks, Rochelle. And that certainly leads into a couple of questions that we've got moving forward. One is around expectations around communication between service providers and assessment organisations. So, Rebecca, would you be able to clarify what your expectations are around communication from providers? For example, if someone's needing to have a wait list closure, or if they've got specific questions around a client assessment or review, what process would you like?
Well, we've got two avenues, as I'm sure everyone else here has, the good old email and the phone. So don't hesitate to pick up the phone. We've got a whole team that manage all of our inquiries, our Voice of ACNA, our client services and support team. So yeah, picking up the phone is great. With the people here in Victoria, we'll go out and connect. So it's not just about people knowing that they can connect in with us. Part of our job and our commitment is to make sure we go out and we're involved in your, even in your team meetings, if you want us to come and present, in your local community gatherings, in forums, formal forums like this. That's a really, really important part. So us going out, as well as knowing that, please pick up the phone, send us an email. That's the best way to keep the communication going. And we've got extra people for that in this early phase. We know that when anyone starts an assessment program in a new region, you need to have even more opportunities to connect and more people responding. So those communications being smooth and responsive at this time is really, really important. So we're committed to that.
Thanks, Rebecca. And I could certainly see lots of nods coming from Michelle, Fiona, and Jess and Rochelle there as well. Does anyone have any additional information to add to that? Michelle?
I absolutely agree with Rebecca, but I also would like to go back to Rochelle's comment and the main way for people to make sure that we know that their services are available is reflecting correctly in the portal and making sure your postcodes are correct, especially given some service providers don't work across aged care planning regions, they work in local areas. So just wanted to reinforce that with Rochelle and the rest of the team. Thanks.
Thanks, Michelle. Probably one of the biggest questions that is on people's mind, and I think we received most of the pre-webinar questionnaires, was about waiting times. So I'm just wondering if you can give us an idea of waiting times for assessments. I suppose, often older people might go directly to services and are referred into My Aged Care, but there may be some kind of ongoing communication. So, what advice can our service providers be giving to older people about those processes? So I might, Jess or Fiona, you want to?
Yeah, sure. Thanks, Lisa. As people would appreciate, there's been quite a high volume of outstanding assessments in the changeover piece. So basically, we're working through those on a priority basis. I'm really pleased to say, of the outstanding people who were designated as a high priority, we've already assessed those people. So there's no backlog there now related to high priority, which is really good, because a number of those people had been waiting months and months, and that's a source of, understandably, that's a source of great frustration. So we're really pleased to have quickly been able to turn that around. Where we've got a couple of areas where we're almost, couple of the aged care planning regions where we're almost into managing the referrals as they come through as business as usual, if you like. There's no backlog. And then in the areas where there is a backlog, we're again quite strategic on how we're working through those based on priority and when that referral came through. So really, we really appreciate the sensitivity of this, and we've briefed both our scheduling team and our assessors so that they understand the context here is that, you know, many people have had a really untimely wait, and we want, with all the colleagues on the call today, we want to be part of turning this around and getting a much better outcome for older Victorians. Yeah.
Thanks, Fiona. Michelle, what about the areas that you're working across?
Yeah, absolutely. I agree with Fiona. We've got strategies in place as we're working through our client list that have come through in the first sort of week of July, and we are making some headway. It's really hard. It's a really hard question to answer. So for Aspire, we've got a substantial amount of people working in the area, as I know the other orgs as well. So to put a timeline on it, I probably couldn't. And I think we need to be really careful to if people are saying, you know, it'll only be a week or two, I think we need to be very careful as an aged care group, service providers and assessors, but we definitely are working at getting those done as quickly as possible. If I could say, across our organisations, our normal business as usual is that we work within our timeframes that are given by the department. So once we do work through that, you know, our current bulk amount of clients, then I think across the board we can consistently say we work with the 10 days for the high referrals, 14 days for the medium and 21 for the low. But be very careful saying that just at this point.
That's fine. Thanks, Michelle. Rebecca, was there anything that you wanted to add?
Just confirm what everyone said. We're the same in that there's two parts to what we're working through. It's the bulk amount that came through the 3 days before the 1st of July. So going through, getting any high priorities there and actioning those immediately. And then each day we get the new referrals through. It is a little bit hard to look at the timelines of wait, because sometimes when a new referral comes through, the way that the outlets are configured, it might put a slightly different date on it. So, you know, reiterating Michelle's words, that putting a time frame of, you know, a week or 2 or 3 on it is hard, because sometimes you've got to go back through the notes and find that original way, because the portal likes to date stamp things sometimes a little bit differently than maybe what the client is expecting. We have our team up and running. We're working through assessments. We're getting through those high priorities, both in the support plan review queue and in our assessment. So I'm feeling really confident, and, you know, it's already the 8th of August, my goodness. And by September, you know, we're rocking and rolling at full capacity with all of the wait lists being cleared. So yeah, I'm feeling really positive about where we'll reach in a short time. Yeah.
That's great. Thank you for that. So I suppose the key takeaway for our audience is that, yes, there has been a backlog, but certainly your organisations have been working very hard to work through those and addressing them in order of priority. Rochelle, I just wanted to just on assessment, you know, in Victoria, as you know, we have been, as a general rule, we've had one assessment service per local government area. And obviously, now that we have a total of 12 assessment organisations, the geographical area that you all cover is much broader. So it's likely that as a service provider, they're going to be receiving incoming referrals from one or more of you. Can you just kind of explain how that's going to work? How do you, the assessments that are coming into My Aged Care, how are they divvied up? What does that look like?
Look, I think there's a very detailed algorithm that sits behind how MAC does that, but I think it's that they are assigned to the different assessment agencies, and then within the areas that those assessment agencies work within, and then obviously those assessment agencies will work to ensure that they refer to the appropriate CHSP providers within the area. But it is a big change. As you said, we had at one point, we had 76 RAS providers in Victoria. That was, delivered by local councils, ACAS, health services, community health organisations, ACOs and not-for-profits, and often they would provide just within a local government area. So obviously there was a very local connection and strong connection to the local community. And I think what I'm certainly hearing from my colleagues here, and what continues for the Victorian Department of Health contractors too, is that commitment to providing local support for those communities and linking them in with those services that are provided in that area too.
One of the things that we've talked about briefly is around people from a cultural and linguistically diverse background or First Nations. Can you, I might throw this to Rebecca, can you advise us how your assessment staff and whether they look at the specialisation verification of CHSP providers within My Aged Care when they are discussing those service choices with clients?
Yeah, absolutely. And it goes back to what we were talking about earlier of having a workforce that's representative of the communities they serve as a collective workforce, but also the lived experiences. So understanding culture from a lived experience being part of the community perspective. And I also want to reinforce Rochelle's plug earlier for updating the My Aged Care service provider portals with the specialisation verification framework on there, so that we can identify those really easily and effectively. So I don't know if I answered your question there. Well, yeah.
I think absolutely. And it's great to see that assessors are actually utilising the specialisation verification when discussing those service options with clients. Jess and Fiona, you were both nodding. Did you have anything further to add there?
Nothing further to add, just like Rebecca, like Rebecca and I'm sure all of our colleagues here, this is something that's very important to the assessors and the client experience. So we absolutely, it forms part of our assessment. It forms part of discussion around referrals and client's choice and client's need, and it's absolutely part of the assessment piece. But agreed, as if we can ask that information is up to date within the portal and it's displayed, it absolutely supports this.
That's wonderful. I think a very clear message coming out of this webinar today is if you are a service provider, we really encourage you to go look at your portal as a service provider. Do you have the right postcodes in there? Is there a good explanation of your service? And I would certainly also encourage you to go in as a consumer and have a look at your portal and see what older people are seeing as well. So I suppose one of our final questions, and I think this has come through very clear, is there any other advice that you can give to service providers that will help make the assessment activity run more smoothly, make it easier and for older people who are accessing aged care assessment? What can service providers be doing to help this this process? And I might, Rebecca, if you've got any ideas.
I do. I think when we all set a shared collective expectation for older people and what they can expect from the aged care system, and what is a home support assessment and what is a comprehensive assessment, and what is it that we try to do, and that idea that we're here to put you on an aging journey that promotes your independence. It enables you to live longer and a rich life at home. And that is the purpose of our regional assessment services, is that independence at home and that entry-level assessment. So just being really clear about what the purpose of the assessment is, the outcomes of the assessment. We're going to look holistically at what we can do for that aged care journey for the person in front of us. So those holistic conversations are really important. Yeah, I think that's what I'd emphasise, but happy to throw over to my wonderful colleagues here as well.
That's great advice. Thanks, Rebecca. Michelle, was there anything that you wanted to add?
Rebecca, I couldn't have said it better. The working collectively together on that aged care journey, we are all a part of that, and owning that whole journey and making sure that our connections are strong and we work together is extremely important to all RAS assessors, but mainly to the client. So making sure that we as a collective can make that journey as smooth as possible for the client is one thing for us that we definitely work towards. I think and I think just taking on a little bit more from Rebecca, like when you are referring a client, try not to preempt the outcome of the assessment. Like promising or over promising can really lead to some really hard discussions for people. So letting the assessment take its course and working out, whether or not they're at which level people are at is part of that assessment process. So I think that's important. And just one little personal thing, like for service providers individually, if you've got a wait list and sometimes I suppose, and I'm happy for other people to comment, but we have, if there's a bulk rejection, just say that there's at some point where you're unable to provide services, making sure that the client's aware that that's happening, because keeping them informed on the journey is extremely important. And lastly, I won't repeat to make sure that we're reflected correctly on the portal and the postcodes. Thanks, everyone.
Fabulous. Thanks, Michelle. There has been many questions through the chat, and it's great to see that as the discussion has occurred today, I would suggest many of those have been answered in responses. So thank you so much for that. We are going to have a look at some of those questions now. I think at the moment there's some amazing takeaways for CHSP providers, that you are embedded within local communities, you're offering face-to-face assessments as well as a range of other supports. We understand that there is a backlog and a delay, but that is ramping up. So that is fabulous to hear that those priority clients are being seen and being assessed. So thank you. Alison, have you got a couple of those questions from the Q&A that we can have a look at?
I have. There are a lot of questions, so we certainly won't get to them. Quite a few about face-to-face versus phone assessment, which I think you've all covered off on that. Obviously, we know face-to-face is ideal, but in the interim, there will be some phone assessments. The other one that's coming through is around contact. So contact details of all the RAS assessment organisations. So we will provide that to you with email, telephone, and personal contact, names. So the other part of that question is, how will we know which assessor is in our area? So the Commonwealth Department of Health have a resource listing which provider is in which area. We will also provide that to you as well. Another common question about contact was, will you, as providers, will you be able to attend local networks or have any of your assessment staff attend local networks? And I think, as Rochelle said, in the past we had 76 RAS providers, so it was easier, obviously, for RAS assessors to attend networks. But just very quickly, do you foresee in the future that any of your staff could network at that local level? And I'll throw that open to anyone.
That's a massive yes for us. That's one of our favourite parts of our job. So, yep, send forth invitations, let us know what's on, and we'll keep our eyes and ears out as well.
Great, thanks, Jess.
And that goes the same for us. We do participate in our other regions and absolutely moving into the Vic space as well.
Spire for Life, that's a yes as well, and definitely working within communities of practice is a great excitement for us as well.
Great, excellent, thank you. That's good news. There was another couple of comments about care finders. So do you work with or have connections with care finders? Michelle?
When I first did our introduction, I omitted to say, not on purpose, that we have a care finder program, just a small one in Western Sydney, where we are not a RAS provider. So yes, that it's interesting. We've already started networking with our care finders, trying to work out how we can prioritise or streamline those referral processes and implement our current practices in our other regions to make sure that that we implement that in Victoria as quickly as possible. So hopefully, and we are aware that the care finders, there was a ramp down. So hopefully now there's starting to be a ramp up of referrals to those care finders, because care finders are an absolute integral part of the aged care journey. And so definitely for us.
Right. Fiona or Jess?
We are exactly the same, not a provider of care finder, but absolutely working with care finders.
Okay.
We have very strong relationships across across our other regions we work across. And again, we have made connections within the regions in Victoria, and will continue to do so. So they're a very important part of the assessment process and for client journeys.
Rebecca, anything to add?
It's the same for us. I know Beck Ward, just to be really confusing, Beck Ward is our senior clinical assessor in VicRAS. She was in contact with them yesterday, and she's really working hard to build all those connections, the contacts, the phone numbers, the people, the events. So yeah, absolutely, care finder is critical to it.
I was just going to say, and when we were
Sure.
talking about what advice, and I think just acknowledging that this is a transition period. We've had a way of doing things in Victoria that's now changed. And so what I'd encourage all of us here and out in the sector is probably just a little bit of generosity in the time that it takes for these changes to come on board, and that we're all learning a new process and learning what our roles are, what our responsibilities are, how we engage with each other to get the best outcomes for Victorian older people. So I just encourage everybody to maintain that generosity of spirit in this space so that we can achieve that.
Yes, well said. Thanks, Rochelle. A couple of allied health questions, particularly around the GEET to go, so goods, equipment and assistive technology. Is that something your assessors are across? And there was some conversation about missing referral codes, and if they're missing, how would the allied health staff be able to follow that up? So would anyone like to answer that one? Go, Jess.
I'll jump in. So yes, GEET to go is absolutely a service that our team are aware of, use, and have good contact relationships with. As we're building our team, and we do have newcomers in the assessing space, if a referral has been missed, to be able to support, please reach out to us, because we will absolutely look at rectifying that. And it's a learning process for new starters as well, that some of these additional referrals to come together. But yes, absolutely, GEET to go is a huge part of our assessment process and a huge part of the referral process. And if there's anything that has been missed, please touch base with us. The details will be shared, so it's pop an email through or give us a quick phone call, and we'll ensure we work with the assessor to get that fixed up.
I just wanted to say as well, I've popped a link into the chat for everybody, which includes a list of all assessment providers nationally, but more importantly in Victoria. And there are quite a few questions in the Q&A about the geographical areas that are covered. And we have kind of talked to this today, but I think it's really important to just reiterate that these assessment providers are covering a whole planning area, not just a specific local government area. So if you have 3, 4 or 5 assessment services in what you traditionally know as your region, it is likely that into the future you may receive referrals via My Aged Care from all of those assessment services. So just for people to be aware of that as well. And I think the other question that we probably addressed early on was just about how referrals are sent out. So I think just confirming, you know, the broadcast referral, you're likely to see referrals being broadcast, and in certain circumstances, it will absolutely depend on the client. There may be instances where there are direct service referrals as well. So, and I can see our panel members nodding. So just to clarify those couple of points.
Most of the other questions are quite similar, and I think we've covered a lot. There are some we haven't covered, and we are running out of time, so we will have a look at them and get some answers back out to you, along with all the other things that Lisa has just spoken about. So Mel, I will hand over to you.
Thanks, Alison. I just really want to thank all of our panel members and George for your engagement today. It's quite daunting to sit here as providers and have an audience of 600 odd people. We really appreciate your candid honesty and your commitment to not only assisting us here today, but ongoing in relation to community and localised connections. So thank you so much for all of that. We will be, as we know, we're recording the session and we will have that out to you sometime next week, along with the resources that Alison mentioned. We also have a commitment to look at that follow-up opportunity for CHSP providers in relation to the service delivery questions that we've received. And I note that there's a number of those also within the Q&A here today. So on behalf of all the panel members, and I'm really want to say thank you for the all the participants here today. The interest in today has been overwhelming, and we're really excited to be able to start this communication process and continue it on so that we can have great relationships between CHSP providers and assessment staff, whilst we keep the client at the centre of everything that we do. So thank you, everybody, and we look forward to having these opportunities in future.